So much for staying with us. Our Saturday retrospect will come right after our interview as we're going to delve straight into the matter of the day. Well, on the health scene, Lassa fever has been trending recently in Nigeria, especially with cases rising. It leaves a lot of critical, questions and concerns as to the gaps in our healthcare preparedness and awareness. Well, to talk more on this issue is a medical doctor. His name is Dr. Callistus. He's right here in the studio to give us his perspective. Good morning, Dr. Callistus. Thank you for joining us this morning.
Good morning, Dr. Callistus.
Thank you very much.
So right. Thank you so much. I'm sure that every single person who has come of understanding must have heard of Lassa fever, although they may not know what it really means, but they must have heard, oh, Lassa, oh, Ebola, oh, this, oh, that. So please tell us, in simple terms, what is Lassa fever?
Okay, Lassa fever is a viral disease that typically is transmitted by the normal rat, usually the multi-mammate rat, many-breasted rats. We call it the Mastomys natalensis. So typically, it will call people that are come in contact with this rat will typically come down with flu-like symptoms. That's all these malaria symptoms.
Okay.
So you typically will think the person is having malaria. So headaches, joint pain, weakness. Then they now progress to having bleeding from all their nose, mouth, and all of that. Then very high fever. That is why it's called an acute viral hemorrhagic fever. So in short.
So what exactly are the causes of Lassa fever?
Okay, Lassa fever is basically caused by contact with the multi-mammate rats. That's this Mastomys natalensis. So either you eat a food that has been eaten by the rat, or you eat a food that has been urinated, as a food that has been exposed to rat, either the urine, the feces, or anything. Or even when you come in contact with a symptomatic patient, as someone that's already contacted this Lassa fever and is symptomatic, then you now come in contact with the body fluid or this person or the blood. Then you typically come
Dr.
down.
Callistus, let's just break this down, because I'm sure, I'll always use an archetype of a Mama Nkechi, who is a market woman that sells in probably Obwete, and she doesn't understand what it means for a rat to be multi-mammate, doesn't understand what viral means, doesn't understand body fluid, doesn't understand all those things. Yeah. Now, you know that rats are endemic in Enugu.
Definitely.
Should we be afraid of all rats, or there are classical differences that because there's this rat, the ones that are smaller with long-mouthed hair, are those the ones you're talking about? How can you actually explain these kinds of rats so that they can avoid it at all costs?
Okay, we'll call it multi-mammate rat, meaning it has many breasts.
So if we catch a rat, we check.
Breast you look at.
How will you catch a rat that is possibly infected?
You're not going to start catching rats generally, but when you from a distance look at a rat, you typically
Some
know
people
whether
don't even have that
time to look
the
at
temerity to look at the rat. They see the rat, they take off.
Then you want to actually
Avoid
all
all
rats,
rats.
because rats spread diseases, not just Lassa fever, but the ones that will typically spread the Lassa fever are the multi-mammate rats.
Okay, now you said something that is very interesting. You said that the symptoms of Lassa fever mirrors, at least the early symptoms,
Yes,
they mirror malaria fever. You know,
Typhoid.
malaria is also endemic. So at what point do we get to know that, okay, this is not malaria and we should, go see a doctor? Because you also mentioned blood coming out from the orifices. And I'm thinking in my head, at that point, it should be too late. So we are trying to see, how can Mama Nkechi or her neighbors know that, okay, this malaria that is happening to Nkechi now, this fever that is happening to Nkechi now is no longer malaria fever, but it could be something else. So at what point, just tell us those cardinal signs.
Okay, when someone comes down with malaria fever, joint pain, or any of the symptoms that they would, group as malaria symptoms, and you have given paracetamol you have given anti-malaria medications and the fever does not seem to come down, then you should be thinking something else.
Lassa fever.
That is one. Two, you are giving malaria drugs, even when you are giving it, the fever does not seem to come down. Fever is supposed to come down and go up.
Malaria fever.
Yeah, malaria fever is intermittent. So during the day, the person is fine. During the evenings, when the malaria parasites are in the system, the person comes down, is weak, and all of that. So that is the typical, presentation of a malaria symptom. But when it is not that way, the fever is just progressively increasing and all of that.
Progressively increasing.
Even when
As though it's a bacterial or
mimicking typhoid fever, that's enteric
typhoid fever, yes.
So when it's progressively increasing, you should know that this is no longer malaria. And then you're giving medications, malaria drugs, you're giving antibiotics. Typically, Mama and Kechu will go to the chemist to go and buy malaria and typhoid drugs. So, mix something, and then you mix it 2 days, 3 days, nothing is happening. Then the person should actually present to a clinical facility where they'll be reviewed.
Okay. So, are there like drugs or anything that can be taken to prevent this?
For when it comes to prevention, it will be better to look at, or it will be better to prevent the disease from coming at all.
So there are no vaccines at all?
No vaccine.
There's no vaccine for...
Currently, there is no vaccine ready for
Lassa fever. So someone that is contaminated, what do they take then if there's nothing to cure?
There's a cure for Lassa
fever.
If not, everybody will die. Everybody that has gotten Lassa fever will die. So there's a cure for Lassa fever. The medication we usually give is ribavirin, which we give in the hospital. But much more than the medication is the supportive care we give. I remember when I did my internship in a specialist hospital. That's the biggest Lassa center in West Africa. So that was why I did my house job then. I remember that most of the things we do are mostly supportive. So you make sure that you rehydrate, you encourage the patient to take enough water. Of course, while they are doing the oral rehydration, we're also doing our IV fluid therapy, and then oxygen, depending on how compromised their lungs is. Then a few other things, but most times we also give ribavirin.
So before we get to treatments and the types of treatments, because we have spoken to the cause, we have spoken to what it is, you have also spoken to prevention. Let's talk a little bit of from the public health point of view, right? Now, why has Lassa continued to invade our healthcare ecosystem? Why haven't we been able to arrest Lassa fever? And then, why are some states more vulnerable than others? Are they host factors other than just rodents? Are they predisposing factors that could attract more rats to a particular place? So just take us through that.
Okay. So, like malaria, Lassa is endemic.
Oh, it is?
Yes. Lassa is endemic in Nigeria. Lassa was discovered in 1969 in a Lassa town in Borno State. So
what you're telling us is Lassa originates from Nigeria.
Yes.
It didn't come from anywhere like Ebola.
Anywhere. No.
Wow.
Lassa originated from Borno State.
Wow.
In Nigeria. So it's not only Boko Haram that
don't go there.
Okay, so 1969, a nurse died of Lassa fever. That was the first case. And then
so we've been able to isolate a novel virus and call it our own. It's I'm not saying it's good that we own something that it actually speaks to how robust to a reasonable extent our healthcare system is far back in 1969.
Yes, we are doing
because it wasn't the whites that came to identify this virus. We did this ourselves.
Definitely.
Kudos.
So a lot of work has gone into research in the area of viral hemorrhagic fever generally.
What do you mean by viral hemorrhagic fever?
Ebola, Marburg virus. I explained it when I started. Viral is a virus disease.
Okay.
Hemorrhagic, it will literally present with bleeding, bleed from all the orifices, eyes, nose, mouth, ears, then the genitals.
Okay.
Then it comes with fever.
Okay.
You cannot have Ebola. Sorry, you cannot have
Lassa fever.
without having fever. It doesn't.
Okay.
Okay,
that
so
is-
speak to the predisposing factors
Okay, so
and why some states
It's,
are more vulnerable.
Vulnerable.
so we said it's typically carried by the multi-mammate rats.
Multi-breasted rats.
Okay, now some towns, some areas in Nigeria, they still eat rats.
Okay.
So if
You know there are different kinds of rats.
Exactly.
There
There's
are
bush
the
rats
bush
There's a
rats.
bush
that you eat.
yeah,
It's actually bush meat.
I know, but when people eat rats, there's a tendency to eat everything that is rodent. Because why some people are well to do, others are not. So the people that find it difficult to make
the
ends
proper-
meet, they just get anything as long as it's rodent, it's rats. So eating of rats is an issue. And communities and environments where the socioeconomic status is still poor,
Like in a slum or something like that.
those areas are still be predisposed to continual infestation of rats, because they are either the rats find their way into their houses, or they find their way basically the rats find their way into people's houses.
No, I think they work hand in hand. You find more infestation of rats in slums rather than in,
And then people have the tradition of spreading their things, foods and all of that outside for it to sun dry. So these are the cultures we have in our systems that will continually predispose us to,
Are they other host factors aside lifestyle? Maybe, I don't know, you're the doctor. Are they other, because you just mentioned lifestyle, living arrangements and things like that. Are there other predisposing factors that could be hosts related?
Typically, anything that does not bring us close to rats
Okay,
will not.
great. Now let's talk diagnosis. How do you diagnose?
How do you
Lassa?
diagnose her?
Okay, making diagnosis of Lassa is clinical. Alright, the definitive diagnosis for Lassa fever is PCR, DNA, RNA PCR, which is something you do in the hospital.
What is that?
It's a polymerase chain reaction. Typically, you take your blood, you take sample of your blood or any bodily fluid, and then they run it.
Is
through
this
a
available in
PCR
primary healthcare?
machine. No.
That's the problem.
So, how can it help? How
But
do
you can also
diagnose
make
it?
the diagnosis clinically.
Okay.
When you have gone through what I just explained before, you have asked, of course, through history and examination. When the patient comes in, you are asking one or two questions. When did this headache start? When did this body pain start? When did this fever start? They tell you, okay, it started 1 week ago.
Okay.
Or it started
Speaking to the
2
incubation
weeks ago.
period, yeah?
Yes, literally 3 to 21 days. So it started
Okay.
2 weeks ago, it started 10 days ago. So, okay, what have you done about it? Say, I've taken malaria drug, I've taken typhoid drug, and it's even worsening.
Okay.
And then I'm getting weak every day. Then my urine is changing color. Because that will usually be the first. My urine is changing color.
Before it
Then you
turns
should
to
now
blood.
have a high index of suspicion. Okay, this is probably the Lassa fever. So what you need to do is to what? You quarantine this
The
person.
person.
So they are quarantined. Tell us, it means it's contagious.
Yes.
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 Please tell us tell us the mechanism of, of someone with contact infecting another person.
Once you are symptomatic, that means once the symptoms start showing on your body,
What kind of symptoms?
the
Fever.
fever, the generalized weakness, and all of that. These are the
Even the
symptoms.
early stages,
Yes.
the person is quarantined. What
Yes.
about the family?
Everybody.
Is
Everyone
affected.
yes, once a diagnosis of Lassa is made, anybody that made
Wow.
contact with that person should be quarantined.
including the healthcare provider.
Every single person.
Now, how can healthcare, because they will present to a clinician
Yes.
and their blood samples will be taken
Take it.
to the lab.
Okay, before that, let's finish with what we're talking about.
I'm just trying to get a mental picture of how do you protect yourselves?
the truth
for
is
that long.
The healthcare
No, not just
professional is
because whoever is coming to you, you don't even know.
no, yes.
that
And
the
you can
person
even
is
exchange
infected.
handshakes and things like that, touch your stuff on the table. How do healthcare professionals protect themselves?
That's why we have what we call a standard medical procedure for everything. You are supposed to examine a patient wearing gloves
But this patient has touched surface in the
in the
lab.
Let's
Yes.
hear him. Let's hear him out.
Yes, I can remember when I was doing my house job in Edo State, my team we operated on a patient that had Lassa fever. We didn't know. So I wasn't in the theater that day eventually. We were like a team of 6. So the other ones I was doing the clinical work and in the ward, and then they now have operated on the patient 3 days in after the operation. Okay. A day after the operation, we discovered that this person had Lassa. So everybody was now vigilant. Then, of course, like I said, the person must be symptomatic before they become
Transferable.
Yes. So within 2 days, 3 days, our colleagues were still fine. So of course,
Okay, ruled it out.
but after 2 days, they
The
started
third day.
showing signs of. So we now had to
Quarantine
quarantine
them.
them.
Now, I've had discussions with doctors about HIV when someone is exposed, because there have been cases where there are needle pricks or somebody vomits, body fluid is
fluids.
transmitted somehow, and there's something they call what's the word I'm trying to remember? It's not treatment, it's prophylaxis.
Prophylaxis.
Yes. Now, when, like you said, your colleagues were exposed. Were there some kind of prophylaxis?
Yeah, there's no prophylaxis.
It's possible with HIV.
Yes.
And
there is
HIV is virus.
prophylaxis, yes.
How come Lassa doesn't have prophylaxis?
Probably it's still work in progress. HIV is global. So there's a lot of money being
Attention.
pumped and attention being pumped
Towards
into
Wow.
seeing that something comes out. Like there's a vaccine, there's medications, pre-exposure, post-exposure prophylaxis, there are drugs for them and all of that. But Lassa fever is mostly West Africa.
Okay.
Now we're
And
talking public health. Now, if I understand the West correctly, well, those guys are, what's the word, for lack of a better word, are afraid of emerging tropical infections.
Yes.
Shouldn't they beam their searchlight on Lassa? Because someone in Nigeria can actually transport Lassa from here to the West.
Definitely.
So is it that we are not making enough noise? Guys, see another one, no? It's another one, according to musicians. Is it that we're not making another noise, enough noise to get the attention of WHO or any of these, international, PEPFAR, whoever, these international organizations that are health-based? What are your thoughts?
We are, but you can only, most times, interest will always influence whatever that happens.
Okay.
Typically, if Lassa fever is going to come into a country, basically from transmission from someone, that's when in the West there are barely rats there and all of that, so they are not afraid of getting it through rats. It's majorly somebody coming,
Bringing it
and
in.
then the aviation industry has done a lot of work in ensuring that you don't just carry any sick person through. So most times those things are breached at the
Okay. For the period of 3 to 21 days that these symptoms last, after the 21 day, is there no going back on treatment for this victim?
Who should be, if somebody is staying up to 21 days, then there's a problem already. If somebody is staying 21 days before getting medical attention, the person is already going. But at 21 days, a lot of things will start happening. The blood will start coming out, and the more the symptoms you find in the patient, the worse the prognosis.
I was
If the
going to
patient
ask you
comes
what's
into
the
the
prognosis
hospital
of
and
Lassa.
bloods are already coming out from
coming
everywhere,
out.
it means the patient will be having blood loss. Then the person's blood is no longer coagulating. Like typically when you get an injury,
Why?
after a while coagulates.
So the virus
Okay.
has anticoagulation
Good.
properties. So
That's
it thins the blood.
Blood, yes. So when that happens, it means that you are literally losing blood, and then you need to be transfused along the way.
Is it possible to save a patient that has gotten to that level?
Yes, like I was saying, my senior registrar then, he got to that point when he was urinating blood.
Hey.
I was actually the one that was running around to gather the blood for him.
Oh.
So we had to get the blood, separate it, get the platelets that
Yes,
actually
yes,
prevents,
yes,
and
yes.
then give it to him. So they can be saved, yes.
It's really
At
scary.
any point, a patient can be saved, but there needs to be a lot of attention given to them. Oxygen.
Now, given the state of our primary health care, how prepared do you think primary health care ecosystem is equipped to handle Lassa? Because if your senior registrar was in a remote
Tertiary
place,
institution.
no, not just
Okay,
station,
if you
tertiary,
were
in a remote place,
environment.
I don't think the concerted, health efforts would have, been brought to bear to save him. So, because we said that these things are prominent in probably rural areas and in slums, how prepared are primary healthcare, the healthcare centers in the village to cope with this kind of health emergency?
It's unfortunate to say that our primary health cares are not prepared for it. They are not really prepared at all, because most of the preventive measures that will require or that will be required to ensure that these things do not continue is health education. That's continual health education. Telling people what needs to be done and what need not be done. But our healthcare systems are not equipped with such level of management protocols to handle those things. When you go to a typical healthcare center, most times there are no drugs there. That's true. So they are not equipped. As in most times when they try their best and nothing is happening, they end up bringing them to the tertiary. In fact, I would want to say that Nigeria does not typically operate the primary, secondary.
You just bring the person straight to the
You're supposed to be
tertiary.
having malaria
Yes,
in a
yes.
secondary
Outbreak.
healthcare facility. You're not supposed to having somebody come with malaria and typhoid into a tertiary institution. It's not supposed to happen. So they're not.
Okay, so we know that with malaria, there are herbal concoctions. We know the dogonyaro. A lot of research has gone into herbal local herbs and treatment of malaria. And you say Lassa is indigenous. Has there been research, into herbs that can actually treat or to reasonable extent offer palliative, relief to Lassa patients? Because we know of dogonyaro and a few other herbs for malaria. Since Lassa is indigenous, any herbs? Because there are many people that may not be able to afford tertiary healthcare institutions. So are there any of such herbs anywhere, even though the research is not holistic, but they are pointing to a particular herb? Okay, maybe chew onions or do this or that.
One mistake people make is to assume that management of Lassa is costly. It's actually free.
Really?
Wow.
Yes. If you go to when I was in Edo State, it's free. Once you
In
come
Edo
there,
State or everywhere? in
Everywhere.
all the Lassa centers. I'm aware of Edo State because I worked there.
Do we have a Lassa center in Enugu?
I am not particularly
No,
sure.
that's the thing.
I'm not particularly sure. I think we have in Ebonyi State, which is close.
Yes.
So how do you treat your Lassa patients? Because there have been
Once
a
we
few
have-
cases in Enugu.
Once we have patients, we can manage them. A doctor can manage patient, but when there are no facilities, when there is no specific room where you can quarantine
Quarantine
these
them.
patients, so where you can isolate this patient now and then manage objectively, then you want to refer.
So where do you move them to?
Edo State, typically.
You always move them
Yes,
to Edo
Edo
State.
State.
But we have a Lassa fever center in Ebonyi State. So why is Edo State better?
As a doctor, you send someone to where you are very sure of, where you are fully aware of. I'm not so sure of the Ebonyi State one. I'm very confident in where I worked, so I typically would send patients down to Edo State.
Okay, so tell us.
Then when it comes to you talked about traditional herbs and all of that.
Yes.
The problem is Lassa fever is often underdiagnosed. They don't even have the technical know-how.
But you said it could be diagnosed clinically.
Yes, by a doctor. So a doctor will not go prescribing herbs. No doctor will prescribe the No doctor will do that. So, and even sometimes doctors can underdiagnose Lassa because someone can come down with Lassa and it will not bring the person down so much. Yes.
Maybe the person has a strong immunity system.
And then their body, because all viral diseases are supposed to be self-limiting.
All?
Yes.
I thought it was just the flu.
No. All viral are supposed to, but some are very virulent that before they
like corona.
Before they elapse Ebola, before they elapse their incubation period, they take the patient. So
okay, so what's because we have mentioned Ebola and Lassa. Please tell us the difference between Lassa fever and yellow fever.
Yellow fever, they are all it's just what causes the
origin, the etiology.
What causes the
okay, but in their presentation, in their symptoms, are they the same? I just want a situation where Mama Ngozi that is watching us now will know, okay, this one is tending towards probably Lassa, this one, just that little, knowledge that this is tending towards Lassa, this is probably yellow fever. What are the symptoms that they will look out for and say, okay, this person has this, it's probably yellow fever.
Whether it is Lassa fever or yellow fever, their job is to get the patient to the hospital. Because it's not their job to know whether it's Lassa.
Yes.
As long as they've given malaria drug, they've given their typhoid drug, and it's not helping, then they should actually move this man, because either one of them could be detrimental to the life of the patient.
All right.
Okay, so I want to know, in a nutshell, can Lassa fever ever be eliminated from our society?
That's a long shot. A very long. Because if you want to do that, then there need to be a lot of synergy. It's not just a healthcare thing. It's not just a government thing. First, we have to start with general health promotion. So we need to inform the village heads and encourage them to teach their people in their languages that there is this rat that need not be
multi-breasted rat.
So the rat should be declared a public health concern.
Yes. So that is the first and the most important step towards achieving that. So if you can pursue these rats away from the houses, and this is dry season, the rats will leave the bushes where there are no more foods and then
come to the house.
That's why during the November to May,
it's more prevalent.
Yes. So if during these dry seasons people still leave their homes open, the rats crevices are still in their house, they don't cover their foods, the rats will still find their way back. So to actually eliminate, if it's even possible, we've not even done that for malaria, let alone. If it's to eliminate rats, this is all that we need to do. We're ensuring that the village chiefs teach their people, that the community heads teach their people, the government continue to hammer it, tell people that this is a rat that's actually causing this, and then encourage them, teach them, bring them into some lifestyle modification that will help. Don't eat all these rats, don't spread your things outside, then keep cats, because cats can actually help.
Chase rats away.
Likes cats. Okay, so I have this.
Then, even the healthcare professionals, because you need to also teach the healthcare professionals how to effectively manage Lassa, because it's not every healthcare professional that can manage Lassa.
Okay.
And then because of the poor systems, poor healthcare systems, it's not every healthcare professional that follows the standard operation and a medical procedure for examining a patient. Most times the patient walks into using their hand to examine it. Even when the patient is coughing and is bloody, because there is no hand glove, sometimes you are moved by compassion to do
help.
something first before. Do you understand?
But then safety first. All right, you know that with malaria in a lifetime, an individual can have as many bouts
Of malaria.
of malaria. Is Lassa the same way?
Yes.
Really?
One exposure does not give you an immunity.
This is no fair.
You go through that thing again.
That's why it's a viral disease.
Really?
Yes.
But do you get to a point where your immune system,
Yes. The more you're exposed,
the more you're exposed to,
yes,
the more
you're exposed.
it builds up?
Yes.
Wow.
I can remember during the COVID-19 period when we were working, most of us had COVID-19 and we were still working.
True.
It was no longer
Yes.
A thing.
Yes.
for
Even now.
us. People had been exposed.
Over
again and
time.
again. It became an easy one for everybody.
Okay, so we are gradually winding up. Tell us, what are some of the medical advice you could give to someone that is watching you now, aside the fact that they need to watch how they live, not spread their food items outside? What are the other lifestyle changes or random advice you could give us to speak to prevention of Lassa?
Typically, you want to give advice the general public that healthcare should be priority
Yes.
in your mind. You should not just live your life as though you are indifferent about it. When you have medical symptoms, when you have clinical signs in your body, and you have done the basics, please present to a standard healthcare facility so that you will be checked. Don't be too concerned with, because we are having problems with money and all of that, but don't be first money. Always find yourself in a healthcare facility where you will be properly checked so that you don't fall victim of something that can be managed.
Absolutely. Thank you so much, Dr. Eze Callistus. Thank you for your insights. I'm sure someone has learned something insightful
I have.
this morning. All right, you know what they say in adverts: if symptoms persist after 3 days, you should do what?
Call your
Consult
doctor.
a doctor. That statement still holds true. All right, don't go anywhere. New Day continues right after this break.